All right. And hello, everyone, and welcome. Thank you so much for being here. I'd like to introduce today's speaker, Dr. Sheuer. And we'd like to say we're so excited to welcome Dr. Kim Sheuer to speak today. For a little background, Dr. Sheuer is dual board certified in both family medicine as well as lifestyle medicine, has a master's in deaf education, conversant in both American Sign Language as well as Spanish, licensed in over 20 states, and is a certified facilitator for CHIP, which is the Complete Health Improvement Program, an evidence-based lifestyle intervention designed to prevent and facilitate the reversal of common lifestyle diseases, which has generated over 40 scientific publications showing a measurable impact on clinical results. Dr. Sheuer is the founder of her practice, DOKS Lifestyle Medicine, which provides education in lifestyle medicine to help patients achieve their best health without medications and through diet, exercise, and stress management. We're so happy to welcome Dr. Sheuer to Downstate. Thank you for being here.
Thank you. Thank you so much. So I'm going to share my screen and I'll stop signing. Whoops, sorry. So give me a second while I get this going. If I can figure this out. Play. Yay. All right. I hope you all can see me. It looks weird on my side, but.
Looks good.
Looks good.
Okay. Trying to find, okay, wait, let me do. Okay, so you know what? I need to escape one more time and just get rid of this so that I can see what I'm doing. Okay, so my name is Dr. Kim Sheuer, as he mentioned, board certified in family practice and lifestyle medicine. And what I'm going to talk to you guys about is using lifestyle medicine in a traditional family medical practice. So currently I work for DOKS Lifestyle Medicine, where I do group things with CHIP, the Complete Health Improvement Program, but I also work for Plant-Based Telehealth, which is a telehealth program that is one-on-one and does lifestyle medicine. Before that, I worked for 20 years at Aspen Medical, over 20 years at Aspen Medical Care in Aspen, Colorado, and we had several different clinics and did traditional medicine until I was about 47, when I decided that, wait, my mom had breast cancer when she was 48. How do I prevent breast cancer in this next year? A little late, but it worked. And so I read the China study and started to do some research. A friend of mine was a nutrition. I had been a junk food vegan for most of my life. I called myself a Milky Way vegan. And she said I ate like crap. So she helped me adjust to a whole food plant-based diet, started doing research and was amazed. So for most of my career, I was the traditional family practice person where I would give out medications and treat the symptoms, but not go to the root cause of the disease and turn off the faucet. When I started doing it for myself, I lost tons of weight. My cholesterol plummeted, my energy improved, my knees stopped hurting. It was amazing. So I did it on myself first. Then I started using it with patients. And what I saw in my office every day was chronic diseases, heart disease, obesity, cancer. Acute illnesses, accidents, depression, and anxiety were a major part of my practice. And I was working in Aspen, Colorado, where people are generally fairly healthy, they think, but there's a lot of unhealthy paleo, keto people and lots of visitors. So every single appointment, whether it was chronic, acute, accidents, or depression, I would bring up lifestyle medicine once I learned about it. And as we know, lifestyle medicine is a growing body of scientific evidence that shows that lifestyle changes can deal with 80% of the chronic diseases we deal with, and has a lot less toxicity and side effects than pills or surgery. So, and I can't tell you how much it's changed my patients' lives and my practice. It's amazing. I don't know if you guys know, but there's the American College of Lifestyle Medicine has 6 pillars: nutrition, activity, avoiding toxins, adequate sleep, stress reduction, and relationships. Rochester Lifestyle Medicine Institute added 3 more: time outdoors, purpose, and finding joy. And these are all involved in every patient interaction I had. We know that the standard American diet makes us sick and fat. And there's tons of research that's coming out more and more that a plant-based diet is much healthier and is the way to go for individual health, environmental health, the animal's health. And so there's lots of ways to go about it. We also know that we don't quite work so well in exercising in America and moving. We sit a lot. And so trying to get people more active makes a huge difference in prevention of certain diseases, like including cancers, breast cancer and prostate cancer, and makes a difference on heart disease, diabetes, et cetera. And there's a lot that works against us. You all know that there's big business. There's even the foods in hospitals. We get no support. Major medical associations don't give us support. Commercials on TV and social media are amazing. And when I was training, people smoked all the time. Physicians smoked. Respiratory therapists would be outside smoking cigarettes when they were called to a code, and they could barely get to the code. There's publication bias in medical journals. And unfortunately, in medical school, we see the medical journals, but we don't see the nutrition journals, which has a lot of good information. And in fact, when I was training in the 1990s, Dean Ornish came out with his first publication about reversing heart disease with lifestyle medicine. I never knew about it. I was so mad when I found out. I was like so mad. But there's false advertising. You just have to follow the money. And again, we don't get training in medical school. I mean, I think I had 1 hour of nutrition about how to do parental nutrition, but nothing about true nutrition. Doctors don't want to do it. I had, when I was working in Aspen, I was trying to get the hospitals to stop giving bacon after a heart attack. And the cardiologist, getting him on board. He's like, well, I know the research, but I can't do it. So I'm not going to have my patients do it. It's the same as tobacco. It's very frustrating. So getting to teach you guys about this is great. And I tell every single one of my patients that they can take control of their health, that they can let food be their medicine, and that they can take care of it. And it's not just food, it's everything. It's meditation, it's exercise, it's relationships, et cetera. But as you guys know, or will know, when you start seeing patients, there's a lot that works against us. Time. You're giving 10 to 15 minutes with a patient. It's ridiculous, depending on what field you're in and what you're doing. Reimbursement. We don't get paid for talking to our patients about lifestyle changes, but I'll tell you how you can do that. We have patient buy-in. They don't, nobody else has mentioned it to them, so it's very difficult. Or if I can convince my patient that they should be eating fruit when they have diabetes, but their family says, where are you going to get your protein? Don't eat your fruit. We have to get family buy-in. We also have to get coworker and boss buy-in. Now, I was lucky when I worked in Aspen, I owned my practice, but I still had a hard time convincing my family docs and pediatricians to not give kids lollipops after they get their shots. I was like, are you kidding me? This is ridiculous. So it takes a lot of work to get coworker and boss buy-in. And by the time I left Aspen, when I had been doing this for maybe 7 years or so, I had 90% of my staff was plant-based and would focus on lifestyle with their patients, from front staff to back staff. So being an example makes a difference. So how do you do it? First, you go to conferences, you get educated, you learn from the leaders in the fields, okay? You get the stuff that you need. You get and I'll tell you some specific ones to do. You use tools like how you have your vital signs, you have your blood pressure, pulse, height, weight, et cetera. I use a tool called the 4-Leaf Guide to Vibrant Health. They have a 4-leaf survey that I would give my patients every time they walked in, no matter what they were in for. They were in for a cold, now lacerations, I'd talk about it, but I wouldn't give them that. Or heart attacks, no, I deal with the heart attack, but I would talk about it afterwards. And the 4-Leaf Guide is a really quick survey that they can do in 30 seconds, which will tell me where they start. And then I used it as a vital sign. And I would say, okay, and I'll show you the paperwork. You're right now better than most, but we want to get you to the top you can be, and they would see how their blood pressure would change, or their sugars would change, or their cholesterol would change, depending on their level of what they were. I would also, time efficiency is really important. So I would use an auto expand when documenting charts and just, so everything I would tell my patients about lifestyle, I would put it out, and I'll show you that. I'd give tons of handouts. So I gave homework. I said, you're going to have some goals and you got to come back. And that my bosses like that because then they got people to come back. But I would give homework and they would do a lot of it. And the SMART goals are, I would give them specific, measurable, achievable, relevant, and time-based goals. Okay, so I want you to walk for 15 minutes after you eat 1 meal a day for the next week, and then 2 meals a day for the next week. Or I want you to add 1 piece of fruit a day. So specific, measurable, achievable, relevant to them, what they wanted. And then you learn how to bill, and you learn how to bill appropriately. So if somebody would come in for, obesity, it was easy. I'd bill for obesity, but then I would also deal with some other things. They'd have heart cholesterol problems. They've had hypertension. Learn how to bill for your time so that you can time bill, you can do other billing. That is important. It's a pain in the butt, but you do need to learn it. And again, being the role model makes a huge difference. If you don't do what you say, how do you expect your patients to do it? So here are some handouts and tools that I used. For example, the 4-leaf survey is from a book. Ooh, and I need to get some information. If you guys want this book, I will send it to you. It's really good. It's about, there we go. Oops. I'll show it to you later because that's on my slide. I don't think you can see me. I don't know if you can, but this is the book. It's very short and easy. And it has a quick survey. How many pieces of fruit do you eat a day? How many pieces of vegetables do you eat? Or how many servings of vegetables do you eat a day? How many dairy foods do you have a week? How many eggs? How many sugar, white flour? And then you add the add up really quickly. I had it in my system so that it would just come in and automatically add up for me. And I started better than most. I was -2 when I started. I got to be a 4-leaf, which is 40, which is 80 to 100% of my calories from whole plants. Whereas before I was 10% of my calories from whole plants. And when I did that, weight plummeted, everything changed. And so you can follow that. One day, okay, you came to me at -2, now you're at 10, now you're at 40. People can see the difference on their weight, their energy, their blood pressure. It's great. It was a great vital sign. I used it often. And I would give out handouts, for healthy kids, growing healthy kids, protein sources, etc. I had tons. This is an example of, some of the things that I handed out to people. A quick base, the Plantrician projects, plant-based nutrition quick start guide. They had it for kids, for adults. The vegetarian starter kit, which is very simple and easy, nutrition for kids. Even Kaiser Permanente has little handouts that you just can give to your patients when they leave. And it has tons of resources. I also auto-expanded. So when I put .health, it became patient-informed options for continued health issues, and I went through everything. And I would give them a handout, but it would just auto-expand into my chart. I adjust it for my patients. So if it was somebody who was a young kid, I'd work more on Mike the Vegan than on Nutrition Facts, but everybody got that, or PCRM, or, it had a lot of things. And then I'd always have on the bottom, if you adopt this lifestyle and this diet, if you're on blood pressure meds or diabetes meds, you need to contact me immediately for issues, because people would plummet their blood pressure and their sugars quickly. I mean, within days of changing their lifestyle. So anything that you can do, and these would all be printed out and handed to the patient, it'd be easy. I wouldn't have to go through all of this each time and type it in. There's tons of resources out there, and it's not limited to below, but I had a lending library of books that I like to use, like How Not to Die, the China Study, Mastering Diabetes. And if you guys haven't read Mastering Diabetes, it is the best book ever by Cyrus Kambata and Robbie Barbero, who are amazing. And it's great for, I learned more by reading that book than I ever learned in medical school and years of training afterwards. There are great movies out there, Forks Over Knives, What the Health, The Game Changers, etc. There's great websites that I tell all my patients to look at, and you guys should look at it too, nutritionfacts.org. PCRM, which is Physicians Committee for Responsible Medicine. If you don't know about it, get on it. Plantricianproject.org has tons of free resources for people. There are YouTube videos. MedCram actually is not necessarily lifestyle based, but has incredible information. He's just brilliant, and has great stuff on COVID, things like that. Mike the Vegan, who's not a physician, but is very research oriented and very clear, has great information for younger people. He's like the younger Michael Greger, more hip. There's support groups like plant-based nutrition support group. So I get my patients hooked up to that because, you know, when they left me, they needed some resources. Rochester Lifestyle Medicine Institute, the Complete Health Improvement Program, Plant Pure Prescription are courses that people can take. Rochester Lifestyle Medicine Institute actually has a course for medicine, for medical providers and medical students. And it's great for CME. And it teaches you all about lifestyle medicine that you won't learn in medical school. And it's very comprehensive, very good. Plant-based nutrition healthcare conference is, the Plant-based Nutrition Healthcare Conference, best ever. Oh my gosh, loved it. Started with 300 people when I first went many years ago, now up to 4,000 when it's in person and not when COVID, with COVID, when COVID's over, it is, you'll see orthopedists, cardiac surgeons, family practice, internists, radiologists, all kind of medical doctors there. And it's just so, the lectures are amazing. The food is incredible. The energy is amazing. PPOD, Plant-Based Prevention of Disease, another great group. ICNM, the International Conference on Nutrition and Medicine, that's put on by Neil Barnard's group. Lifestyle Medicine Conference, it's great. I mean, there's just so many things out there now. There's journals that I would highly suggest you join. The International Journal of Disease Reversal and Prevention, specific to lifestyle medicine, and it's all researched. Professional societies get it hooked into the American College of Lifestyle Medicine and the American Board of Lifestyle Medicine. And then there are these great grand rounds monthly done by Rochester Lifestyle Medicine Institute. You can find it on Zoom. You can get on their website and check into it. They have had some of the top in the field on their during these grand rounds. And so, for example, there was diabetes, there was one on heart disease, there was one, the last one was on lymphoma and how you change that, how you treat people with lifestyle medicine. It's fantastic. So there's somebody a physician who presents, then there's people on the committee that talk about it, and there's questions and answers. And get all these resources, start where the patient is, gear resources towards their interest of specific disease or personal health or environment or animal rights. Just hit them where they're interested. I mean, because if somebody comes in for a cold, they don't particularly want to know about lifestyle medicine, but I can easily say, if you eat healthier, if you exercise more, there are studies out there that show that exercise decreases the length of cold, that certain foods and certain things improve your resistance to colds. And now COVID, there's so much research out there about how lifestyle affects COVID to decrease, morbidity and mortality. So have those things available, have a list of all the research out there that you can just give to the patient. Look, here's the research, it works. So that's, and MedCram has some good stuff on there. So these are some things that I used. It's becoming more mainstream. The most recent journal of American Journal of Family Practice addendum had a huge thing on family physician's introduction to lifestyle medicine. And it was a whole section on it and talked about everything from food, movement, sleep, and it was really well done. So check that out if you haven't seen the most recent one. And then I wanted to talk a little bit about successes that I've had, because people don't believe that it really works. But so for diabetes, for example, I see so many people with type 1 and type 2 diabetes. And I had a couple of specific ones. I had one person who came in to see me. She'd been She had been type 2 she got diagnosed when she was in DKA and in the hospital for 10 days. So she was on a huge amount of insulin. She came to see me, and luckily she saw me at the end of the day and my last patient canceled. So I actually had an hour with her. And in that hour, I said, I'm going to tell you everything that everybody else told you differently. And so I told her a completely different thing. I said, what you're doing isn't working. Your sugars are out of control. You're unhappy. You're overweight. You're unhealthy. And so I gave her lots of resources. I told her to read How Not to Die, the chapter by Dr. Michael Greger on diabetes. And then I told her to read Mastering Diabetes. And I said, I want you to start cutting your insulin in half now, if you really do this, only if you do what I say. Within 13 days, she was off of all of her insulin. And her head was not confused anymore. She had lost a significant amount of weight already. She stayed on it. She goes, she sent me a message saying, I didn't believe you. I still don't believe you. I don't understand it, but this is working. And I gave the book to my mom, who's now getting off of her insulin. So when you can get the time, use it to teach them and give it. I told her, you don't have to believe me. Go look at the research, but what you've done for the last year and a half after this diagnosis has not worked. And then I had another person that I met on the road, a neighbor, and he has been type 1 for I think 30 to 40 years. And I just was talking to him on the road and got him interested, got him to change. And he's now on half of his insulin. So actually it's longer, 30 years of type 1 insulin diabetic is now on half of his insulin and getting off of more meds because of just meeting him on the road and doing some lifestyle changes and reading Mastering Diabetes and this stuff. And then I had another one recently who came to me. She was type 2, feeling terrible, doing everything right, already plant-based, already doing everything right. And she said, I don't get it. I'm so frustrated. So now she started eating more vegan junk food and nothing was working. She's very unhappy with herself. And you're still doing medicine when you're doing lifestyle medicine. And I said, look, we need to do some tests. I don't think you're type 2. I think you're type 1.5. I think you have an autoimmune thing. And so the good news is I think I know what's wrong. The bad news is you're going to be on insulin the rest of your life. She said, I'll do whatever. And so we switched, she couldn't afford the testing actually. So I switched her, changed her whole diet back to a very plant-based. I put her on a low dose of physiologic insulin and she started doing great, feeling great, doing well. And then we finally got her antibodies and a C-peptide, some tests to tell me if her pancreas was working, whether she was having an autoimmune component to her diabetes. And we re-diagnosed her as type 1.5, which is a lot of late adult onset diabetes. And so you're still doing medicine, but you're changing people's lives. It doesn't matter whether you're type 1 or type 2, you still need to decrease your insulin resistance. Hypertension, hyperlipidemia. I'll give you a couple examples on that one. My significant other, when I first started dating him, was on 5 meds. And I said, look, we're going to go on a date. I'm bringing the food. We're going to go camping. And he was on 3 for blood pressure, 2 for cholesterol. When we started dating and, we started getting really serious and I was like, everything's clean in my house. You have to eat the way I do in my house. He ended up losing over 60 pounds and getting off of the 5 meds. And then I have a cousin of mine called me and she said, I'm having issues. I started working with her. Turns out her husband, to support her, started doing all of the same things. And her husband was supposed to be starting blood pressure meds because his blood pressure was so high, but you could see when he started doing this, his blood pressure just came down. He now no longer needs meds. So it's kind of nice, even, where you have families do that. Actually, I have another example of obesity. I have so many people who've lost weight, including myself, by doing this. I had struggled with weight all my life till I was 47. At 47, in a menopausal period, I lost weight and I have never gone back. I eat way more than I used to and much healthier. And that happens with all my patients. In fact, I had another patient of mine who had her husband come on. I saw her, the last time I saw her, she said, can my husband come on and talk to you? And he came on, he said, I wanted to thank you because in supporting my wife, I've lost 15 pounds, feel great, and doing what you told her to do. So it makes a huge difference. Autoimmune and Ortho, I'll use myself for some of this. I've had my first knee surgery when I was 18 because I was a ski jumper. And at 47, before I started this, I was like, oh, I'm going to need knee replacements when I'm 50 because I had both my knees done. And since being on this, I just got back yesterday from skiing with my family. I was skiing all double diamonds, all moguls, and my knees feel great 10 years later because I'm not on an anti-inflammatory diet. I have no inflammation in my body. So I have the arthritis. I have the arthrosis, which is the damage in my knees. If you took pictures of my knees, it's bone on bone. But I don't have the arthritis. I don't have the inflammation, so I don't have the pain. So, I mean, I can out ski my 16-year-old nephew. And I just spent, 5 days skiing the bumps, and it was a blast. So, and I see that with my patients. I see their arthritis improve with anti-inflammatory diets, with more movement. Endometriosis, I had a patient recently who was 19, who has endometriosis and severe PMS, premenstrual syndrome, where, cramping, missing school, had to be on birth control continuous and hated them, absolutely hated them. And still had to be, she was on high dose meds before she had her periods. I said, are you willing to do anything? She said, yes. So I put her on a plant-based diet, added soy to her diet. We waited 3 months, got her off her birth control. She lost, instead of gaining the freshman 15, she lost weight, and it feels great. Her energy's great. Her brain is great. She's able to study much better. And when she had her first period afterwards, it was great. She's like, this is amazing, off of birth control. Prostate and ED. So erectile dysfunction, I've seen patients with PSAs improved significantly, even with cancer. They've, for those who are watching weight, their PSAs have reversed. We've seen prostates reverse. Dean Ornish has proven through lifestyle medicine that you can affect the telomeres and affect genes, and you can turn on or off genes with your diet in prostate cancer. So I've had that. Erectile dysfunction, if anybody hasn't seen the Game Changers movie yet, watch it. There's a whole thing in there about erectile dysfunction that is hysterical. And your younger high school, college age guys will definitely change their diet after watching that. It's a great movie if you haven't seen it. And then the other unexpected changes I've already mentioned to family. I've had people whose gums have stopped bleeding. Eyes, I had one woman who was getting injections every 2 weeks in her eyes, and now she's every year. Her ophthalmologist can't believe it. Headaches improve, energy, all that. So those are some successes. And for all of us, we need to live the lifestyle, because you guys are studying so hard. It's hard to do it, but take time to eat healthy, take time to move, take time to take breaks, to laugh, to meditate. Continue to find your purpose in life. Live the lifestyle you prescribe for your patients. I do, and I want you guys to. And then for more information, go to dokslifestylemedicine.com. There's a resource page which has everything's free and all these resources, or contact me through there. And if you're interested in the 4-leaf guide to vibrant health, which I'm going to stop my share for, maybe. Where are you? Stop. This book is amazing. It's very easy for patients. It's very easy for physicians. And I can send, if you guys give me your address, I can send you guys a bunch of copies. And I didn't write it. I do know the people who did write it. It's a family practitioner out in Rochester, and an environmentalist. They wrote it together, but it's fantastic and it really helps. So Sorry if I talk fast. That's the way I am. Any questions?
Thank you so much. Just wanted to say that was a fantastic presentation and learned a lot. I have two questions, actually,
Okay.
kind of a two-part. So one of the things I'm very interested in is, and particularly just kind of myself, is some surgical subspecialties, particularly as you mentioned, like ophthalmology and urology.
Okay.
So I've shadowed both fields, particularly ophthalmology. They see like sometimes 70 patients a day, let's say,
Yeah.
1.5 minutes, things like
Yeah.
that. But it's such a field, I feel, that could be this measure can be incorporated into for diabetic retinopathy, proliferative, non-proliferative. As you said, VEGF injections. I mean, you go from months to like once a year. I've never heard any conversation about diet, and even in the literature, I've seen one article maybe on meat consumption from Japan and diabetic retinopathy. I mean, it's so scarce. So I'm just wondering, what is your take on providers who see, tons of patients in a day to incorporate this into their practice and possibly expand on that?
Exactly. So, I mean, I was seeing, up to 30 patients a day in my traditional practice. And again, it's the handouts. So if somebody came into me with diabetic retinopathy or something like that, or, evidence of diabetes, I would immediately say, here's some websites that you should go to. Here's some places you should look at. So PCRM will have information on that. If you don't have the time, say, okay, here's some plant-based doctors, plant-based telehealth. We are all lifestyle medicine boarded. We have the time to get together with patients and specifically for that. So if I was in a subspecialty, I'd be like, go to your own primary care physician. If they are not up to date on lifestyle medicine, then go to a specialty place like plant-based telehealth or Neil Barnard's, they've got the Barnard Medical Center, depending on where they are, or Rochester Lifestyle Medicine. I would give them a website, I'd give them a handout. And the handout would be very easy. Here's where you can look up some of this stuff, like PCRM, just put it, or nutritionfacts.org, put in eyes, just put that in, and they'll have 5-minute videos on eyes and how plant-based medicine can help them. So Nutrition Facts is more plant-based. Lifestyle medicine would be Rochester, which has plant-based plus the other stuff. Plant-based telehealth would easily be able to help them. So find those, give those kind of resources to the people. But also, again, the lending library makes a huge difference. So if you're interested, or, here, you want to find out more, I'm going to hand you this thing, this Plantrician Project Quick Start Guide. And it has, all of it is, it's all researched in the back. So this, here's a basic booklet you can start with, or the vegetarian starter kit, which is from PCRM. Have them go to PCRM. Just give them this one little handout and say, you may not believe me now, but this will make a difference. And it's amazing how many people actually listen to what you say. Like people you would never, I've had people come in that I would never have expected to actually change. Do it. And so you can't decide who's going to do it or not. You have to just be open to say, everybody may be interested and and so you have 5 minutes. You can hand them a piece of paper and say, contact me later if you need some more advice on this, or come back. It's harder in a subspecialty to have them come back, but here's the resources. You go look it up. You take control.
Thank you. No, that definitely makes sense. And just feel like it's such an important aspect that doesn't, get addressed so many times. And one other question I had was, this is a little more pertinent to kind of where we're situated. We're a Caribbean population. And particularly when you're dealing with, people from different ethnicities, different backgrounds, who have different dietary preferences, things like that. What is your advice on incorporating this into their kind of dietary routine and adapting their, let's say?
I love that. There is so many ways to incorporate it. So both of these, the handouts are in Spanish. So that's one for the Spanish community. But like I'll have somebody from Africa who comes to America and gets heavier. I'm like, what did you eat in Ghana? What did you eat there? Well, I had sweet potatoes, but that's too much carbs. I'm like, how many fat people do you know there? Oh, well, everybody's thinner. Okay, so start eating your ethnic foods. I mean, for me, I love a variety. My favorite food is Thai food in Thailand, or Indian food in India, or Sri Lankan food in Sri Lanka. It's amazing. There's tons. So forks over knives is do you guys know about forks over knives? I don't know if I do. Excellent. See, always have something at your fingertips. So this is a one from Forks Over Knives. Yay, Forks Over Knives, the cookbook. It's how to eat plant-based and change your lifestyle, change your life with whole food plant-based. It has tons of easy recipes, and you want to make it look delicious, so they have ethnic, they have easy, it's online. There's free recipes. Give them those free recipes. So if you're looking at a different society, just tell them to get online and go plant-based, whatever food it is, and get the recipes. Now, a lot of those have a lot of oils in it, so you got to be careful of the oils. I tell people to, adjust down the oils and the salts. I cook without oil, so I have a sheet on how to cook without oils. I have a sheet of green light foods for mastering diabetes, which will help everybody. I have a sheet. Go to nutritionfacts.org. Go to Forks Over Knives. There's lots of resources now out there. Send them to the free resource page on my thing. They don't have to see me. They don't have to sign up. Just go to the free resource page on DOKS Lifestyle Medicine. I can share that screen with you if you want, but you guys can look it up. There's so many out there now. And in terms of different fields, in neurology now, the Sheuer's eyes have great stuff. In nephrology, Dr. Hashmi has great stuff. In diabetes, mastering diabetes is the best resource out there. There are tons of things in every field. If you go to the conferences, I heard an orthopedist talk about how shoulder, rotator cuff injury is a lifestyle disease. It happens when we're about the age of heart disease. It's the same thing as everything else. It's blood flow to the area. When you have cholesterol in the blood vessels, you have weakened tissues, you have more, and there's tons of studies out there that show that. In my profession in Aspen, we had knee injuries, shoulder injuries, back injuries. Back pain is now, they're showing association with diet and back pain. So you start where the patient is, whether it's, in any place they're at, and get them the resources. And you have little time, have it already printed up and just adjust it a little bit and hand it to them.
Thank you. Appreciate that.
Anybody else?
I have a question. It's interesting that you mentioned that you have to kind of put a disclaimer on the dietary advice, like if your blood pressure is too low. My question is, have you run into maybe tension with a patient's maybe specialty doctor, where you're trying to figure out a best management system for them?
Absolutely. Absolutely. I've had cardiologists tell me I'm nuts, and but then the patients have their experiences and it's so much better. And actually, one of the local cardiologists here finally said, I had a patient who has carotid disease, and I said, look, you need to be on meds. Let me put you on these meds. We may be able to get them off in the future. We're going to do this testing. And then he went to his cardiologist and he's like, oh, she's right on target. So if you know your medicine and you have the studies to back you up, you're good. It's still hard because they don't believe it. Like I had one person who was diabetic who she had really high sugars, and her sugars came down to the normal range with lifestyle medicine. She went back to her doctor, and the doctor said, wow, your numbers are so much better. Your hemoglobin A1C is now normal. I think the last one was an abnormality. That was a lab error. And it wasn't, it was the fact that she'd lost 30 pounds and that she was eating healthy and not, improved diet. So I try not to be against certain people, but, you just give the patients the science, and then they can decide themselves, and they can bring it to their own doctors. And that's the case where Rochester Lifestyle Medicine Institute, the one for physicians and medical students, the course is really good because it's all evidence-based. So many people are into these weird, not evidence-based stuff. And all of this is evidence-based, so you can actually prove it to people. And when the World Health Organization is saying that bacon is a class 1 carcinogen, and you bring it to the hospital and you say, look, you are giving class 1 carcinogens. Why don't you just put the cigarettes back in if you're going to want to do this? And they still balk. Oh, it's the patient's options. Well, no, my patient just had a baby. Or my patient just had a heart attack, and you're feeding them this? This is crazy. It's frustrating, and it's out there, and you get it from the physicians, you get it from other people. So like I said, you're working against them, but you just be the example. You just give the science and the evidence, and you let the patient become healthier. And there's nothing they can say, oh, it was an abnormal lab. But you have to be very clear with the patients. I had a patient this morning who was told by her endocrinologist not to decrease her insulin. Well, she's waking up in the last couple of days with sugars in the 40s, and she's on a continuous glucose monitor. I use it with her. I'm like, whoa. This is too dangerous. You got to cut. She scared me. I almost called the police for a check on her because I couldn't reach her. And, I'm looking at her continuous glucose monitor, freaking out. And that's because her other doctor said not to do it. And you're just like, look, this is bad. How do you feel? I feel like crap. Well, do what I say. Let's start working on what I say first, because your sugars are way too low now because you listened to me. And so you've got to just prove it to them and be careful, like, oh my God, I'm going to be sued because I made her better. Shoot. And her meds are bad. And you got to be really, really careful with antihypertensives and really, really careful with insulin specifically, and get people off meds very quickly. And there's a whole thing about deprescribing and how to do it. But I've had way too many people. And also on thyroid medicine. I've had people get off of thyroid medicine where, they'll start having symptoms like hyperthyroidism because they've lost weight. They're not inflammatory. They're on anti-inflammatory diets, not affecting their thyroid anymore. Their thyroid's improving, and then they're taking too many meds. So you've got to be prepared to get people off of meds, which is a great feeling, and they love it because they don't want to pay for it. Other questions?
Yeah, I have a quick question. Maybe
Sure.
it's a 2-part question, or we'll see. So I'm just curious to know, when you talk to your patients and you recommend a vegetarian diet, do you recommend like organic vegetables versus non-organic vegetables? And in some cases, patients that don't really have access
Mhm.
to organic vegetables, how would you go about recommending their diet? I'm just curious to know.
Yeah, that's a great thing. I have a lot of patients in food deserts and a lot of patients in really rural areas, and it's tough. So I don't recommend a vegan or a vegetarian diet because vegans can have, I was a junk food vegetarian for most of my life. And then vegans, Oreos and sodas are vegan, so I'm talking about a plant-based diet, a healthy diet. And so I recommend they change as much as they can. If they can afford, and if they can find organic, great, go local, go organic if you can afford it. But there's plenty of evidence that if you can't, it's still better to eat the apple that's non-organic than not eat the apple. So I go with what they can afford. In food deserts, there are food delivery services. Many people can't afford them. You can always there's a YouTube channel on, I forget the name of it, but you can look it up. $1 foods or cheap foods, or shopping at Walmart or shopping at any of the grocery stores where you can get, it's so cheap to eat healthy. You can get I get a huge bag of red rice. I love red rice. It's like my favorite foods. Or huge bag of whole grain rices and things like that. Huge a bag of beans. So you can get, dried beans are cheap as heck. So rice and beans are the cheapest thing you can get out there. I tell my patients, get frozen foods. Frozen foods are like frozen veggies and fruits are flash frozen. So you're not wasting money when things go bad. You put it in the freezer, you get a big bag of frozen foods, you use what you need to. So it's a great way to budget. So there's lots of ways to do meal prep and budgeting, as Vivian was saying. There's lots of ways to do it when you can do it with bulk cooking on Amazon and things like that. So even if you're in a food desert, things can get mailed to you. And then to keep from getting things wasted, you know, like I'll get frozen spinach and I'll just put in some of my foods and reheat it and things like that. So there's ways to do it that are cheaper, and there's tons of videos online about that. So I give them those resources while I'm talking to them. While I'm writing my notes, I'm telling them, and then I write my notes such that I can just print up my notes and give it to them. And they have everything on there, you know. So that saves time, it's efficient. Plant-based nutrition support group has a huge thing on budget eating. And again, if you can find things that are organic, great. If you can't, still eat the apple, still eat the, you know, the banana. And there's the Clean 15 and the Dirty Dozen. You can also send them to that so that the environmental working group has information on which are the better ones to do organic if you can afford some, but not all. Okay. Other questions?
Yes. I had a question. Breast cancer is very near and dear to my heart. And I wanted to know, like, as far as those who have a genetic predisposition, like, I understand, regardless of anything, eating whole food plant-based is good, great for you, right? But for those who, let's say, have breast cancer predisposition and going through the prophylactic double mastectomy, would you suggest, as a doctor who's following lifestyle medicine, to do the prophylactic, those who have a strong family history? Or would you just say, let's see how it goes with?
So you're still a doctor, right? Best book ever on breast cancer. Breast, the Owner's Manual by Dr. Christy Funk. Get it, read it, love it. Anybody who is a physician should read this. So the books you should read for sure are How Not to Die, Mastering Diabetes, and this one. There's a lot of other books I can tell you, but again, have it at your fingertip. Learn yourself. This has amazing information. And so if you're BRCA positive, if you have other risk factors, genetic risk factors, yes, I would personally suggest, eat plant-based, eat healthy, get your oophorectomy, your bilateral mastectomy after you've, push it off if you want babies to when you have babies, do as much as you can. And then I do suggest it. I mean, the research out there you just need to follow the research. So, but there's so many reasons to be plant-based. Even if you do, that's the same thing with type 1 diabetes. You're not going to ever get off of insulin if you're type 1 diabetic. You're going to get down to the lowest physiologic dose. What I would need in my body as a non-diabetic is the amount of insulin I want a diabetic to use. That's it. No more, no less, because I want them as insulin sensitive as possible. Okay.
Thank you. And my other question is, I've heard like a few people say, when you're eating whole foods, you can eat as much as you want, but I don't know about anybody else, but I still like calorie count because I can't just be eating, whole foods or not. I can't be eating all day either.
So I don't calorie count anymore. I used to. I was a Weight Watchers. I would have been bulimic if I could make myself vomit it, but I didn't. So I'm half bulimic. I binge a lot. I would starve myself. I did the whole thing. I no longer count calories, but you want to look at calorie density. Okay. So if you're eating low calorie density foods, so anything that's 500 pounds or less, fruits and vegetables and things, and most, not fruit, not all, because like avocados have more. You can eat as much as you want. You just can't fill your body up as much. But if you're going to the higher calorie dense foods, like you want to get rid of oils, that's 4,000 calories per pound. But you want to, be careful on things like nuts and seeds, and be careful on some of the grains. You want to be on the lower end of the calories. You don't have to count calories, but you just have to know calorie density. Chef AJ has a lot of good information on that. There's a lot of good information there's a lot of good videos out there on calorie density. So it also depends on what you're doing. I exercise a lot. I have the ability to now. When I was in medical school and residency, I was sitting a lot. So it depends on how much output you're doing. But it's not just the calories in, it's the calories absorbed. So if you're not absorbing as much, you can eat more. So high fiber, high water dense foods, high bulk foods, you can eat much more than, like, you're not going to overdose on a bag of salad this big. You just can't. You can't get weight. You can't gain weight. Now, I actually have a lot of patients that are plant-based who are losing too much. And so we have to work on the other aspect of getting them to gain, to be at a healthy weight. And that's because they're not eating enough calorie dense foods, where you may be focusing on more, you want to be as high nutrient dense and as low calorie as possible. And then you can eat as much as you want. But you also don't want to eat all the time. It's not, there's lots of good research on chronobiology and when you eat and fasting, because our bodies recover during fasting. So, stopping eating at 7 o'clock and not eating till the morning, PM at night, and then not eating gives your body time to recover. And it depends on what you want. Do you want longevity? Do you want, I don't want to live to be 120. I have no interest. But while I'm here, I want to be as healthy as I can for as long as I can, so, and everybody's different. Some people, can do it differently. So don't go too crazy.
Thank you.
Hi, so thank you so much for your presentation. I just had a quick question. I think it's something along the lines of what Alex asked initially, just about incorporating lifestyle medicine in different specialties that are perhaps more specialized.
Yep.
I guess I'm wondering what the scope is for, like, I know the board certification for lifestyle medicine is kind of like an on by yourself kind of thing, right? Like I think you take a course and then you take an exam for it once you're a practicing physician.
Correct. So you have to be boarded in something else, but then I took the boards the first year they had it. I sat behind Michael Greger. I was like, I wanted to cheat during half of it, but I couldn't. So you have to do, I would highly suggest going to one of the conferences. The Rochester Lifestyle Medicine Institute program for physicians is a great board review course. They also have a board review course through ACLM and ABLM. Mm-hmm. When I took it, it stunk. Don't take it. But I mean, that was many years ago, so it's probably better now. Okay. It's probably significantly better. So you do take a course. You do study like you do for anything else. We took it in person because it was before COVID. Now it's probably online. I just did a lot of you have to do CMEs. I have to do CMEs every year to continue it. And I love the CMEs for it. Actually, I was quite surprised. It was so good this year. You had to review 3 articles, and they were one was on sleep, and I just had a patient who had sleep issues, and it really taught me a lot. So it was really great. So I thought that was very helpful. Like cardiologists, I went to the International Plant-Based Cardiology Conference. Mm-hmm. So for each different specialty, they're getting more and more people involved. So if you go to the conferences, the International Plant-Based Healthcare Nutrition Conference, they have groups that you meet with. Are you interested in endocrinology? You go to your endocrinology group. Are you interested in ophthalmology or you go to that group, or to ophthalmology. They have lots of different groups at each of these meetings. So they have the regional groups. So if you're in South, if you're in the South, if you're in the West, if you're in the North or the East, but they have ethnic groups, and then they have the specialty groups, and it's great. So it's, you'll get a lot of exposure there. And again, you have limited time, you give information specifically for your field. And it's great.
Sorry, if I could just ask one follow-up to that.
Absolutely.
So I guess, so going off of that, let's bring up the ophthalmologist example, I guess. Like a practicing ophthalmologist who wanted to integrate lifestyle medicine, would it be possible to do I guess what I'm asking is, like, with this board certification, are you able to only really practice lifestyle medicine within your specialty, or are you able to like just practice lifestyle medicine more generally, like preventing like obesity as well, or is it only going to be like diabetic retinopathy kind of thing?
Oh, no, you can do as much as you want. It depends on how much time you have with your patients.
Right.
Depends on how you set up your practice.
Okay.
So I set up with my old practice, I was limited in time, which is why I went into what I'm doing now, which is DOKS, and set up my own. So, orthopedic hand surgeon is going to have less time to talk to her patients about lifestyle medicine during the middle of seeing a busy clinic or surgery. But after every surgery, you can give them information. You can give them, in your clinic, have stuff on your wall. They'll ask you, what does this mean? Have handouts available, give it to them. And you might have to send them back to their primary care physician to adjust certain things, like if you're doing it from an eye point of view, but they're on meds that will drop their pressures or their blood pressure or their cholesterol or their sugars, you need to tell them.
Right.
If you're on these meds, you need to see your regular doctor. This will affect you.
Okay.
So I hope that answered that.
Yeah. Thank you so much.
You're welcome. Anything else? I think we're out of time, but or almost. Any other?
Yeah. I had what I know we are almost out of time, but I had one last quick question for anyone else as well. But this is a little bit different. But in terms of something I heard recently was that most people go to their primary care physician rather than a psychiatrist for any type of issues like depression, anxiety, things like that.
Absolutely.
When you encounter somebody who is, I'm not sure if, either coming to you for that, or when you're talking about kind of mental health related issues with diet, I know that most of our serotonin is produced in our, gut and gut brain axis and things like that. But what is that conversation like, and how do you go about mental health?
So I go from both the gut aspect and the inflammation aspect. So inflammation affects so many things in your body. Inflammation in your brain causes depression. So I put them on a very anti-inflammatory diet, and I can't tell you how many people's depression clears like quickly. Now, not everybody, and again, you're still a physician, but you want the people to be on the least amount of medicine that they need, because you want the least amount of side effects. So I will hit them from all angles, and I'll talk about the gut, I'll talk about energy, I'll talk about movement. It's not just diet, it's movement. I mean, there's tons of research out there that show people who exercise every day that works just as well as, an SSRI in some people. And I talk about, I show them some studies on anxiety. I give them breathing techniques for anxiety. There's a breathing technique, a 4-7-8 breathing technique that works as well, that's been shown against Xanax to work as well. So we hit all aspects, but I really hit inflammation and depression. I hit community and support groups with anxiety. And I also hit the gut. If you're sitting there affecting your gut and having, and not making your own serotonin, then you need a serotonin reuptake inhibitor. Would you rather have the diet, which the worst side effect is you're going to lose weight, you're going to have to buy new clothes, or would you like the sexual side effects of an SSRI? Let's work on these. We may need to put you on an SSRI until we get the rest of it fixed up, but I hit it from all directions.
Thank you.
And I hit it every single time because I've got so many, and that 4-leaf guide thing, the thing, I have shown people how their 4-leaf affects their level on that, how they're eating affects how they think and feel. And I also do food, mood, and exercise diaries. And they can say, oh, I don't feel any better. Well, in the beginning of this, your mood sucked every day, all day. Now your mood sucks every other day. It's improving. So you want to show them how they're improving by something that you got to show them the evidence. And sometimes they don't see it. And I also have family members, watch too, and get involved. Sorry. Any other questions?
Thank you. We just got a comment saying, thank you so much. You're so knowledgeable about plant-based medicine. I learned so much today and got so many resources. Thanks.
Oh, cool. I'm glad. And feel free to contact me. And whoever is there, I mean, if you guys are interested in those books, I actually happen to have some extra ones that I could send your way that you guys can share with each other, this one. And again, I get no money on it. I just thought it was very concise, very easy, and a good beginning for patients and for providers who are into it. And it talks about physician heal thyself, then others, and explaining it and saving money on this. What about protein? It has a whole bunch of other stuff in there, spouses, children, roommates, you know, and it's really for physicians to teach them and then teach their patients. So if you guys want me to send that, somebody send me, put your address in the chat and I'll send it out to you guys.
That'd be great. Thank you. Could I actually send you Dr. Rosenfeld's address and then we'll pick them up from him?
Yeah.
Thank you so much.
Yeah.
Yeah.
And enjoy and take care of yourselves because it's hard in medical school and residency. It's hard. So, you know, give yourselves breaks too. All right.
Thank you so much for joining us. It was really a pleasure.
It's nice to meet you all. I'm so thrilled you guys are doing this. No matter what field you go in, you're going to help your patients and help, you know, and it just ripples out. You know, your patient helps their family, it helps and helps and helps. So we want to do that to improve individual health and the world health, I think.
Great. Thank you
Nice
so
to
much.
meet you.
Appreciate your
Thank you.
time.
Take care.
Take care.